Hi everyone, I'm back. I want to talk about statins. Statins. You must have heard about that, right? Maybe your uncle, your auntie, your mom, your dad, or yourself have been on this medication. A lot of people are taking it worldwide. Okay, but let me state here before proceeding that I'm not an agent of any pharmaceutical company manufacturing statins. No. And I'm not representing any establishment. My channel is based on dishing out medical related info that will be helpful to everyone. And that's what I'm doing here. So whatever I'm going to say about statins, they're just the facts, not to favor statins and not to go against the statins. No. With that, let's go. Okay, they are called HMG CoA Reductase Inhibitors. That is Hydroxylmethyl glutaryl CoA Reductase Inhibitors. Examples here are Atorvastatin, Rosuvastatin, that appears to be the best among them for some reasons, Fluvastatin, Pitavastatin, Simvastatin, that may be useful in certain situations, Lovastatin and Pravastatin. Other antilipids are bile acid sequestrants, cholesterol absorption inhibitors, fibric acid derivatives, and nicotinic acid. Statins are strong, low-density lipoprotein lowering agents, and that is pretty good because we don't need low-density lipoprotein and we don't need very low-density lipoproteins. So they lower the bad cholesterol, and that is pretty good. Rosuvastatin is more potent than Atorvastatin. Both Rosuvastatin and Atorvastatin are more potent than the rest. In other words, Rosuvastatin is the strongest of all of them when it comes to potency, followed by Atorvastatin. Fluvastatin is the least potent. Fluvastatin, Pitavastatin, and Pravastatin are less likely to have drug interactions or muscle toxicity compared to the rest statins. Okay? High dose of Simvastatin can lead to more myopathy and rhabdomyolysis. But why will you give high dose or something that will give more problem if low dose will solve the problem? Statins and bile acid sequestrant have what is called synergistic effects. So statins with ezetimibe will be fine. Statins should not be combined with gemfibrozil. Why? That will increase the side effects. Statins will increase the good cholesterol, that is high-density lipoprotein, particularly with Rosuvastatin, the most potent, and Simvastatin. There is possibility of decreased triglycerides with Rosuvastatin and Atorvastatin. Note this, when you are dealing with Asians, start low, please. What are the possible side effects? Fluvastatin is lipophilic and they have low rate of muscle side effects. The side effects will either be myopathy, myalgia, myositis, leading to rhabdomyolysis, and that would lead to possible renal failure. People on statins could have increased possibility of suicide. It wasn't diabetic mellitus increasing the possibility, increased cataracts, but cautiously presented. Neuropathy is likely going to increase, and this time peripheral neuropathy. Still on side effects, there's likelihood of drug-induced lupus, decreased androgen, decreased immunity, and of course, contraindicated in pregnancy. Note: give short-acting statins at hour of sleep. And why that? Because cholesterol synthesis occurs at night. For example, Simvastatin has very short half-life, so you can give your Simvastatin at hour of sleep, but there's no rule telling you that you can give the rest at hour of sleep as well. Pravastatin is okay for patients on cyclosporine. Fenofibrate is fine with statins. Dabigatran, that is Pradaxa, when used with Lovastatin or Simvastatin, will increase hemorrhage. Monitoring. You can pause as many times as possible to go over Myositis, please. Baseline creatinine kinase is necessary. Baseline aminotransferase levels before the commencement of the therapy. Liver function test now, that is, when you're about to start the medication. 4 weeks into the treatment, you can repeat your liver function test. 6 months and yearly after that. You can have your renal function test also to make sure the kidney is working well, and you rule out diabetes mellitus, hypothyroidism, liver failure, and of course renal failure, just said a bit ago. You need to know the baseline lipids to know how effective the medication is later on. Baseline creatinine phosphokinase. Advise and tell patients about all possible side effects. It takes 4 weeks before the effects of the statins could show on the cholesterol level. So the patient should not expect the magic that starting the medication statins today, Rosuvastatin or anyone you prescribe, that the effects will start manifesting next week. No. Still on monitoring. If liver enzymes are raised, but less than 3 times the upper limit, no problem. You can still give your statins. But note this: if it is greater than 3 times the upper limit, I mean the liver enzymes are raised and greater than 3 times the upper limit, stop the treatment. Find out, are you dealing with myalgia, myopathy, or myositis? Check the creatinine kinase. If it is 5 times higher, stop the treatment immediately. You have to monitor for muscular symptoms and of course cardiovascular risks. Okay, we want to use the level of creatinine kinase to determine how bad the effect of statin is when it comes to side effects. So if you assay the creatinine kinase and it's not raised, but the patient is complaining of body pain, that is just myalgia. Okay? But if it is greater than 5 times the normal value, then you are dealing with myopathy. Now, we want to talk about myositis. Mild myositis will present with creatinine kinase greater than 10 times the normal level. And the muscles will be painful, there will be weakness and cramps. Then you are dealing with myositis. But when myositis is very severe, then you will be dealing with rhabdomyolysis. In that case, creatinine kinase will be greater than 20,000 international units per liter. You could see that I exclaimed at that level. When creatinine kinase is very, very high to the roof, then check out for rhabdomyolysis. And with that, we'll be dealing with myoglobinuria, severe muscle pain, and it's worse in elderly and females. It's horrible in people with concomitant hypothyroidism as comorbidity. It is more in patients on cyclosporin and those taking erythromycin and gevibrosin. Finally, please note this. Measure the creatinine kinase before therapy, and if it's greater than 5 times, that means you are not going to start this treatment at all. Okay? Please. Because you have the good intention to help, but then the person you are helping might develop more comorbidities with the statins. And with that, I've come to the end of this presentation. Kindly subscribe to my channel or leave any comment at the comment section. Thank you.